tell me a little bit about what a consultation would look like at your menopause clinic.
Okay. So a menopause consultation is a very comprehensive consult. So it really does start with a woman really detailing her main concerns, about what she's presenting with, and a lot about past medical history, a lot about family history, a lot about screening, and also a lot about what her goals are and what her main concerns are. So our consultations at HERA, our initial patient consultations, can range anywhere from 45 minutes to an hour. And in that consult, or prior to a patient, when they book, they'll get a booking form. And on that booking form will be a list of questions about, and this will range, and we can go through that together, but this will start with a symptom scorer chart. And on that symptom scorer chart, there are about 28 points and 28 questions listing varying symptoms that can range from physical symptoms of menopause and then mental symptoms of menopause, cognitive symptoms of menopause, genitourinary symptoms of menopause. There are so many. And then end up with just the impacts on work, the impacts on life, the impacts on connection. So they will fill that out. They've also got a form that goes through many questions. So those questions, I can go through those now with you, would be a range of looking at, when their menstrual history. When was a woman's, last menstrual period? When was a woman's initial menstrual period? Can tell us so much about it. And also then looking at period changes, which are a big part of that. So we start with all of those questions. And then when a woman gets into the consult, this is what we're going to start talking about. So I can go through that with you now.
That would be really helpful.
So what we look at is when we talk to a patient initially, by the time generally they have seen us, they have been to see either GPs, or they may have seen their gynecologist for varying range of symptoms. And other times patients may have seen cardiologists, rheumatologists, because of the varying nature of symptoms that women can present.
Psychiatrists as well.
Psychiatrists, you name it. So, and the symptoms are as individual as the woman in front of us, and women present very differently. And a woman is never too old to present with perimenopausal symptoms. You can range from your 30s to your 40s to your 50s. So when we have a patient sitting in front of us, they may often be distressed. They may often be very anxious. They may often be very sad. So you're really sort of sitting in front of someone, and you can learn so much from a face-to-face consult, which is what we love as well. So quite often when she's walked in, I've had a look, and I've had a look at this new patient form and had a look at her variants of symptoms. And we start with the main concerns. What is it that, what is it? What is that impetus to come and see us? And quite often that is the most vulnerable stage, when a woman presents to you. And so how we manage that is going through all of those symptoms with her. So, when a woman hasn't had her periods for 12 months, it often goes on a different path of going through the consultation. But often many women are coming in with a multitude of symptoms. And just having someone listen to you often is a really big thing as well, and acknowledging that these symptoms can be perimenopausal.
I agree. I think for women to come in and feel like they're being heard and not being dismissed or made to feel a bit silly, or that they've got, a lot of women will tell me, I just felt a bit silly because I was saying that my hip was hurting and I was having palpitations, but I was also feeling anxious, but my hair was falling out, and I just felt like clearly I was sounding like I was a bit crazy. I mean, that's what they say.
Absolutely.
And I don't know about you, but definitely lots of tears happen in those consultations. A combination of, I think, of relief and frustration.
Absolutely.
Frustration of what they've been through, and relief to finally hear someone go, well, wow, this is quite a common thing. So don't, you're not weird.
You're not going crazy.
Yeah.
And it is sheer relief on their face. And also when we go through and educate women, you're presenting with these symptoms. You're presenting with heavy periods. You can often present with, irregularity of periods, erratic nature of periods, but also erratic nature of mood, and often fluctuating mood. I want to, I'm shouting at the kids. I'm not concentrating at work. I'm intolerant of everyone around me. They can be quite distressing because the impact.
In relationships is massive, and they feel like, I've had women come in and feel like they're on the last straw of their relationships with their maybe their teenage kids, or maybe their partner, or even maybe work colleagues. I've had women come in and say, like, if I don't sort this out, like I'm going to lose my job, or I'm going to lose my relationship, because I know that I am really going from 0 to 100 over really small things. I'm getting really angry really easily. And it's very distressing for people.
Oh, it is extremely distressing for people. And I guess, I've learned so much from my patients in the last year, because, the impact, particularly now that we're talking about impact, but women that are resigning from positions that they have such experience and knowledge and confidence in, and that loss of confidence in something that they have done for many years, but women wanting to leave their husbands, or that disconnection with their husbands, and their disconnection with their kids, and just being able to say, okay, there might be something that we can do about this, and giving them hope, I think, is the other thing as well.
Yeah, absolutely.
So when we often, listen to symptoms, it will get on to that point where we show them like the impact of estrogen. So education is part of that consultation as well. When we're talking about symptoms, you're saying, well, this is actually the impact of estrogen on your body, and in terms of particularly that neuroendocrine, particularly on brain, is incredibly impactful, and particularly in those early perimenopause where they can be really innocuous, that you're not picking up on those things of irritability and anger, that can start very early on. But even those dips in premenstrual symptoms often for women, particularly, and this is where we go to with menstrual history, that if they've had a history of, in teenage years and in their 20s, of knowing that those 2 to 3 days before my period, I am absolutely moody, or particularly significant. I don't leave the house. I don't want to talk to anyone. I'm withdrawing. So picking up on those really early changes in symptoms when you go back historically, which is a really important part of that history taking, saying, how were your periods? Were they regular? Were they irregular? And how did you feel? What did you have any mood-related symptoms prior to periods? What changed? And often you find as they're going through perimenopausal symptoms, those mood symptoms link them. So they can go from a couple of days to women saying 2 weeks out of the month, I don't leave the house. I don't talk to anybody. I'm isolated. I am so down. I am so anxious. I am so overwhelmed. I haven't fed my children for the past couple of nights. And that is heartbreaking. And they've often done this for years because that awareness of hormonal flux is not there. And that comes on to a lot of women go, oh, didn't even know that was a symptom. Oh, why is my back really itchy? Why am I feeling so fatigued? Why can't I exercise the way that I used to? Why am I so bloated?
And the other one as well is, I don't know about you, but also they'll often say, but I don't have hot flushes, so I thought that it couldn't be.
Correct.
The perimenopause and the menopause, and it's like, God, the fixation about hot flushes and everyone talking about hot flushes, but I don't know about you, but it's definitely not the most biggest complaint that I get at all.
No.
And you're absolutely right. It's those mood and brain, what I call the brain symptoms that are so, so tricky. But, I just one message is like, some people never have a hot flush, but they could have 27 other symptoms.
Correct.
But you don't have to have a hot flush for this to be, it's not like a mandatory symptom.
It is certainly not a mandatory symptom. 20% of women don't have hot flushes. And to tell you the truth, no, it's not the most common. But I do have women, and it can be so varied in terms of women who can have 20 a day. even sitting in front of you, Imogen, Imogen Crump. It is that whole feeling of, I just feel weird, and you know that it's coming on, and it's quite anxiety provoking. But then there's women who have none. And then there are women who talk to their friends and say, but I don't have a hot flash or a night sweat. Maybe I'm not in perimenopause, but I've got those varying other symptoms as well. The muscle aches and pains. I feel like I'm 90 is a really common thing. I feel like I can't get out of a chair in the morning.
Yeah.
That's not right. That's not right when you're 42. It's not right at any age. So, the variants of symptoms. So once we go through those variants of symptoms and talking about their menstrual history, it's also talking about things like contraception. I thought I couldn't get pregnant when I'm perimenopausal. You absolutely can get pregnant when you're perimenopausal. So talking about contraception is really important, and what your goals are, what your fertility goals are, and what, are you still prepared, are you still wanting to have children, or have you finished your childbearing years? And what problems did you have with your contraception in the past? Women that we talk about, why did you put, how was it like? How did you feel on the pill? I was really moody. Or, the Mirena IUD, I felt really moody. It was great when it came out. So knowing that history can then obviously be very helpful for how we manage you in the future as well. So contraception-wise is really important. So family history is another thing that, and when it comes to preparing for your menopause consult, actually knowing a little bit about your family history, if you can, is very useful, particularly for things like clotting history. So if you've had a family history of a few first-degree siblings having blood clots, or migraine with aura, or cardiovascular disease, anyone that's had a heart attack or a stroke at quite a young age, and young age, I mean, 60s even is a young age to have a stroke or a heart attack. So knowing that family history guides us into screening as well. And talking about, we often talk about, have you had a cholesterol check? When was the last time you had your blood glucose checked? When was the last time you had a mammogram or a cervical screening test? That's a really big part of the consult as well. Doing your fecal occult bloods, your poo tests, your bowel screening tests as well. So screening is really, really important. And the other thing we ask about is your past medical history, right? That's also really important in any general practice consult. Have you had operations? Have you had any significant history that you have had to see a doctor about? So we talk about that as well.
And the past psychiatric history in terms of postnatal depression,
definitely.
That's very relevant as well, isn't it?
Absolutely. So mental health history, which goes back into that. Have you ever had a history of premenstrual symptoms, or, that's exactly right, postnatal depression, or even anxiety and depression that may have been diagnosed premenopausally can often be exacerbated, particularly in perimenopause. We've had patients with postnatal depression, and that ends up morphing into perimenopause. Women who have had children in their mid to late 30s that stop breastfeeding. And you sort of expect, okay, there might be a period of time that your periods don't come back, but it's when they don't come back regularly.
Yes.
And you start noticing those changes in yourself. You might not feel like your ordinary self, your energy's down, your mood has declined. So, that's really important in terms of that as well. We often ask about obstetric history as well, in terms of how were your pregnancies? Did you have any complications with your pregnancies? Did you have difficulty falling pregnant? Is really important as well. Looking at, did you require IVF? Did you have a history of endometriosis as well, and painful periods in the past that also can impact on future management? So then we screen about sort of osteoporosis and cardiovascular disease risk, because as we all know, that sort of after menopause, a number of things happen on that estrogen decline. We are at higher risk of cardiovascular disease. We're sort of dwindling down, sort of underneath the men's, the men's sort of cardiovascular disease. But then towards menopause and perimenopause, that risk starts to escalate. We creep up to men's risk in our, sort of past menopause. So screening for any risks for cardiovascular disease. So that would include smoking history, history of alcohol use, and also a first-degree relative. So, a significant family history of heart disease, and checking on blood pressure screening is important as well. So we look at all those screening risk factors. And like I said before, when was the last time you actually had a really good preventative health screen? And then the things that we do, we can talk about too. In terms of bones, we ask questions like, have you ever had a fracture? And obviously a lot of us would have had a fracture in our early days, but a fracture, what we call due to minimal trauma. So it's generally a fracture from standing height. We hear about patients, don't we, that, hip fractures are, the common nature of hip fractures now, hip, spine. So we talk about, have you had a history of fracture, or do you have a significant family history of fracture? That also goes on to dietary history as well. Do you have any limitations to your diet? Are you perhaps vegetarian or pescatarian, or have a lactose intolerance, or, don't have a good, intake of calcium? They're all really important in terms of what are your risks going forward, particularly women who are having really heavy periods and also are vegetarian. That risk of iron deficiency goes up. And quite often those conditions can also exacerbate those symptoms of perimenopause as well. If you're iron deficient, you're going to feel pretty tired along with your perimenopausal history.
Yeah, absolutely.
Yeah. So bones are really important. So all those screening tests are an important part of that consultation. We talk a lot about lifestyle as well, in terms of, we know that women, struggle a lot in those times, and they struggle to move. They struggle to exercise. They struggle, to actually fit all this into their day, to have a good meal plan. The number of stories that you hear that I skip lunch, I skip breakfast because I'm just too busy looking after my kids and not looking after myself. So nutrition's a really important part of that consultation. How do you eat? Do you have a varying diet? Do you include protein in your diet? Is a big part of that. And also lifestyle. How do you move? What do you like to do? What's a good part of your exercise plan? Is talked about. And then obviously towards the end of the consult, we talk about how you can manage that. And quite often women generally feel better once they're actually treated, and that definitely does help.
On Sunday morning, when I was out walking at Terrigal Beach, which is a local beach, I kept crossing paths with a number of women who all had vests on, just like me, weighted vests. And we all gave each other a bit of a knowing look, because these have become very, very popular in peri and postmenopausal women. You might not know what rucking is, but basically what it is walking with either a weighted vest or a weighted rucksack. I personally opt for the weighted vest because I find it very, very comfortable and very, very quick to put on. So for peri and postmenopausal women, there are definitely a number of health benefits that you can gain from walking with extra weight. One of the health concerns that many women have at this stage of life is developing heart disease. And unfortunately, we know in the postmenopause, the rates of heart disease for women really start to accelerate. So why might rucking or walking with weight change that? Well, basically, whenever you're walking with additional weight, it increases your heart rate more, and it basically makes your heart exercise a little bit harder. So hopefully making your heart a lot more healthy. So that's one of the benefits of rucking in comparison to standard walking. So if you're intrigued and ready to start rucking, my recommendation would be that you start low and go slow. So start by choosing a weight that is 5 to 10% of your body weight at maximum, and take it slowly. Go for maybe a 10 to 20 minute walk at first. Don't decide to go on a 5-hour hike the first time you strap on your weighted vest. So we've been chatting to our friends at Rucksack, and I've got a special discount code for you. So if you go to their website, which is www.rucksack.com, so RUKSAK.com, and use the code Shauna15, so that's SHAUNA 15, you're going to get a 15% discount. So whether you decide to go for a vest or whether you decide to go for one of their backpacks, Either way, you're going to get 15% off.
This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.